Yeah, innovation technologies. We discussed that there were two elements of it. Technologies for enabling innovation, for example, Europractice as an infrastructure to provide access to chip making capabilities to, for example, universities, or things like Mathematica, and innovation for enabling technologies like, for example, colloidal nanoparticles or chemical engineering. So those are just meant as examples, obviously, and not an exclusive list of things which should be funded. So, we discussed for quite some time how to develop technologies and by controlling natural or societal processes to enable the technology, as a quantum device engineering, molecular amplification, nanoelectronics as examples. I would, at a later point, we also included measurements, because not everything can be controlled. But many things can be measured to a much larger extent now. You cannot control the human genome, but you can measure it. An important development furthering innovation and technology is open access structures, e-science structures, open collaboration. I think we can do a lot more in trying to support that, in making it beneficial to the participants to collaborate. At the moment, they often see their maximum benefit by keeping things to themselves. We should try to change that. We should try to change reward openness also in publication practices. For example, the case of the clinical trials, I think, is very important, that negative results should be available, and there should be some reward mechanism for the partners who do that. Yeah, and important component is interdisciplinarity that stimulates creativity. It's also essential to really do things which are useful. The valley of death is a term which people usually use to describe the difficulties to translate basic research into medical application, and that's basically you have this vision of lots of researchers busily slaving away in generating high-impact publications, and then a few skeletons of those intrepid souls who actually try to make the things useful to the patient. So, but that's a very general phenomenon. There's a very strong reward structure for staying within your community, within your topic, and going beyond that to solve real-world problems is discouraged. We had quite a bit of discussion on priorities. Some people felt very strongly about the question of no oversteering. With this example of having everything being related to cancer, at least on paper in the grant application, but also there shouldn't be understeering. There should be a very strong support of projects which have very clear paths to application to solve real problems. So not just lip service to get some money and then forget about it, but a really logical pathway why what you are doing will ultimately benefit, for example, cancer patients. There was a discussion about the different time scales. Things have to happen. Some projects will take a long time to really generate benefits. others are very close to applications. There shouldn't be a discrimination against long-term, high-impact, high-risk projects. Those are the ones which can benefit us all most. And there was some discussion about the range of projects in the sense of the moon landing or the genome project, where you want to achieve a goal within a limited period, which still involves exploring multiple pathways to reach that goal, but having enough redundancy to make sure that it gets there, and a vision in which you basically just contribute to a long-term goal, but you don't worry about the exact details, how what you do will interact with what others do to achieve your this vision. Opportunities, barriers, opportunities, open data, any open structure is extremely powerful. You see it on Linux, where the biggest computers nowadays run on an operating system which has been generated in that form. IP laws are essential, but on the other hand, badly designed IP laws are a major barrier. In distributed jobs, individual fabrication, which gives the power, empowers the individual groups, individual researcher to come up with new things, can help a lot to generate innovation. Crowd efforts, anything where you don't have some structural limitation to a very limited number of key persons, has an inherent resilience which is hard to achieve otherwise, but on the other hand, that's not, in many cases, a more a stricter structure is important if you want to get something approved, for example, for diagnostics in medicine. That is a very highly structured, regulated process. The open source community we have already mentioned. Barriers, badly designed IP laws. Segmentation, lack of common standards. Somebody mentioned that there had been 400 different standards on the mobile telephone and areas, and now there are only 40. Ideally, you have a small number of standards everybody sticks to. Security, privacy are serious problems we have to worry about. The guy who made a gun and on his 3D printer and proposed to distribute the program to do it is something we should try to discourage by different means. Privacy concerns are obviously a barrier which are unavoidable. There is a barrier is publication and reward bias. Scientists get rewarded and promoted by publishing high-impact papers, even if what is in the paper is really borderline correct, because it simplifies the truth, simplifies a situation enough to get it into Nature or Science. We have a problem that the journals and the grant-giving agencies and the promoting agents, the promoting groups like to see simple stories, even if actually the processes are much more complex. Closed access publication is also a hindrance. Open publication helps a lot to get access to all the information. Actions, we thought that a combination of blue sky technology development and goals would be most interesting. You obviously have cases in which you really want blue sky without having to think about application, and cases in which you're really focused on the application. But I think the best benefit we will get by thinking about revolutionary technologies which will really revolutionize not just the technology but also an applied area like medicine. Anything which is really focused and guided by solving a goal is inherently holistic and interdisciplinary, because you can't solve problems by if you don't use all the technologies you need. And one argument was that to also put a focus on enabling technologies, so not turn down building up important infrastructures because they are not really research. Any problem solving, in a sense, contributes to research and should be counted as research. Program emphasis on transfer of knowledge from fundamental understanding to technology to application. I think it is important to make sure that really important goals actually percolate through to the final decision of the grant-giving committees. Scientists are good at discussing the technical aspects. They are not good at deciding what society needs most. So in a sense, I would argue, and I've heard that phrase now from somebody else, science is too important to leave it exclusively to the scientists. Scientists should worry about the technology, and the grant-giving agencies, EU's government should worry about what is important enough to spend money on. That was it.